హైదరాబాద్ కేంద్రంగా వేగంగా అభివృద్ధి చెందుతోన్న డయాగ్నోస్టిక్స్ సర్వీసెస్ సంస్థ స్ప్రింట్ డయాగ్నోస్టిక్స్ ఈ రోజు తమ అధునాతన వినియోగదారు అనుకూల మొబైల్ అప్లికేషన్ ను విడుదల చేసింది. తెలంగాణ ప్రభుత్వ ఇన్ఫర్మేషన్ టెక్నాలజీ, ఎలక్ట్రానిక్స్ అండ్ కమ్యూనికేషన్స్ శాఖ ముఖ్య కార్యదర్శి శ్రీ జయేష్ రంజన్ ఈ యాప్ ను సైబరాబాద్ సెక్యూరిటీ కౌన్సిల్ ఎగ్జిక్యూటివ్ కమిటీ సొసైటీ సభ్యులు మమత వేగుంట మరియు మెడికవర్ హాస్పిటల్స్ చైర్మన్ మేనేజింగ్ డైరెక్టర్ డాక్టర్ జి అనిల్ కృష్ణ, డాక్టర్ శరత్ రెడ్డి గారు, స్ప్రింట్ డయాగ్నోస్టిక్స్ సిఓఓ కృష్ణ చైతన్య గారి సమక్షంలో విడుదల చేశారు. ఈ యాప్ కేవలం ఒక స్వైప్ తో ఆరోగ్య సంరక్షణ అనుభవాన్ని విప్లవాత్మకంగా మారుస్తుందని భావిస్తున్నారు. కస్టమర్ సేవలు, సమాచారం మరియు అప్డేట్లను వేగంగా, సులభంగా మరియు సజావుగా అందించడంలో సహాయపడుతుంది. ఈ సందర్భంగా జయేష్ రంజన్ మాట్లాడారు.
Diagnostics, invitees, guests. Let me also congratulate the entire team of Sprint, also particularly Krishna Chaitanya Garu, for believing in technology. We know that technology is permeating every aspect of life, but still there are many people who are skeptical, who think that technology will add to costs, technology will not be accepted by my stakeholders, and therefore many people, despite so much of technology available literally at your doorsteps, are really missing the bus. But I see a completely different scenario here in Sprint. As Krishna Chaitanya Garu was explaining, the diagnostics facilities themselves are state of the art. He mentioned about the way MRIs and scans are recorded using the latest machines. He also spoke about the other innovations that has come in diagnostics, and to now offer another digital tool to help the customers, the clients, record their readings, make sense of their readings, provide those readings very easily to their consultants. Also the point that he made that sometimes it is difficult to understand what the doctor is really recommending, and therefore provide expertise in figuring that out and guiding them to the right diagnostic procedures. So this is something very wonderfully figured, and I'm very confident looking at the way Krishna Chaitanya Garu is running this organization, relying on technology, believing in technology. These are some of the frontiers that he's bound to conquer. Hyderabad, as our minister keeps pointing out, is a wonderful city, a very unique city where biology meets technology, where life sciences meets data sciences. This is the life sciences capital of the country, in some ways capital of the world also. And this is also a very important technology hub. So now is the time to bring more and more life sciences related issues, healthcare related issues before the technologies, encourage them to give solutions, try it out, make it user friendly, make the experience, the UI UX of that experience absolutely world class, and then maybe roll it out. So any future endeavor of this kind which healthcare professionals want to try out, we'll be very happy to support it, bring the technology element. In fact, it's a nice coincidence that I'm here in this event, because just that this app is getting launched. But as I said, let this be only the beginning. Let us continue to evolve. Let us continue to bring more and more tech solutions within this app and in the rest of your diagnostics work. So my congratulations once again to you and your team, and thank you very much for inviting me.
తర్వాత సైబరాబాద్ సెక్యూరిటీ కౌన్సిల్ ఎగ్జిక్యూటివ్ కమిటీ సొసైటీ సభ్యులు మమత వేగుంట మాట్లాడారు.
Hyderabad Security Council, which is focused on safety well-being of ITS professionals, who are about close to 9 lakhs, if I'm not wrong, sir, 9 lakh people in Hyderabad. Of course, we have been focused on safety of women, security, traffic, and other things. But what has been worrying us recently is the wellness, well-being part, the stress levels that some of our professionals are going through. And we've been looking at, most of these being lifestyle, stress-related diseases. And if apps have resulted in, digital apps could have resulted in creating lifestyle diseases, I'm very happy that there's another app that is being launched, which could be the answer. And I hope the Sprint team works very closely with Hyderabad Security Council, and of course I represent one section of the society, which is the ITS team. But I do hope that we'll be able to work together and bring the message of well-being and wellness to everybody. I congratulate the Sprint team and wish you all the best, and thank you very much.
తర్వాత మెడికవర్ హాస్పిటల్ చైర్మన్ అండ్ ఎండి డాక్టర్ అనిల్ కృష్ణ మాట్లాడారు.
I think this is is the first of the kind where a diagnostic app, something equivalent to a food app, is being launched. And coming from the innovative city of Hyderabad, I think it's a proud moment for all of us. And I hope this app, which will be launched shortly by our chief guest, will be a great success. And I hope Sprint does well in the future. And the right person is here, such a hard-working person to bring Hyderabad into the world map. You could see the difference what Hyderabad has, the number of IT companies which have moved into Hyderabad, the new innovative centers. We had an opportunity to meet him once in his office. It's a lunchtime, and his meetings are on, and the parallel is having lunch. Such a hardworking person. I think person opening this app, such a great person. I think it should succeed. All the best.
తర్వాత స్ప్రింట్ డయాగ్నోస్టిక్స్ సిఓఓ కృష్ణ చైతన్య గారు మాట్లాడారు.
One of the most common things that people experience in a radiology is, be it MRI scans or CT scans or PET scans, they are required to stay still for a considerable amount of time without moving. And unfortunately, there are always movements there which result in issues in the scans that are coming. This results in maybe wrong diagnostics or wrong treatment. This is where we, deliver what we promise. So we have the best-in-class MRI 3 Tesla machines, which are AI assisted, and they complete the scan in less than 100 seconds for any part of the body. That basically reduces the noise, that reduces the issues that could result there. Similarly, talking about PET scans and CT scans that are available here, it's the first in South India where the scans are completed very quickly. So we have a 80 slice PET CT scan and a 160 slice CT scan. So when I talk about slices, it's basically the number of images that are being captured in a diagnostic scan. Higher the number of slices, higher is the accuracy of the diagnostics and better the treatment. And this is something that is first in South India that we're having here. Now moving on to the app. The app has been, this is something that we wanted to do since quite some time. And today we are here to launch it. So it basically offers everyone healthcare at home. So right now, the moment one installs the app, we get 1,000 rupees credited into the wallet. Basically, everyone and anyone can access and experience healthcare in the initial launch of the app itself. That being said, there's also a 1 GB data space that is being provided to the customers of the app, where they can actually store healthcare records. Similarly, there are multiple other advantages as well. So if someone's having a prescription and they're not really sure what is being prescribed by the doctor, we have our team of health experts here who actually look at the prescription that is being uploaded by the customer, and they advise the patient or the customer to what is the best report or the best test that they can get done on the app. So overall, this app is something new for us. It is new in the healthcare industry here in Telangana, and this makes healthcare affordable and easily accessible to everyone. Thank you.
ఆ తర్వాత మెడికవర్ హాస్పిటల్ కి చెందిన ప్రముఖ ఇంటర్వెన్షన్ కార్డియాలజిస్ట్ డాక్టర్ శరత్ రెడ్డి మాట్లాడారు.
Being a cardiologist, I'm a very techy guy. I keep using, a lot of devices, and many devices, we have been launching new devices in Hyderabad. Congratulations to all of you for bringing such a wonderful app. This century is going to be a century of data, and data is a new science for new generation. And the most important thing is not just storing the data, analyzing the data, and presenting data to clinician in an understandable way without sparing much time. And that is going to be the key in next couple of decades. So I think I'll try to share few new thoughts, when I'm discussing with one of the guests, Mamta Garu. So you have to work on this data. See, whatever storage you are giving, that is going to be very, very important, because as a clinician, many times patients walk into my clinic and half of the data are being already lost. And this app, offering such an app which keeps entire data of the patient and giving a storage space to the patient, is going to be really, really useful to the patient. But what I think you have to do next is bringing graphical representation of all the data of the patient. I think that is where you have to work, so that clinician can understand without much effort, Second is integrating, lot of wellness apps, which Mamata was talking about. Yep, you can integrate all those devices into your app so that patient can hold. This becomes a single entity which can hold every aspect of the patient. I think that is going to really help patient, and most importantly, it helps clinician to make faster decision, accurate decision, and precise decisions. And thank you one and all.
యాప్ కస్టమర్ అనుభవాలను పునర్నిర్వచించడం, సేవలను సులభతరం చేయడం మరియు వినియోగదారుల ప్రయోజనం కోసం ఒకే స్వైప్ తో స్ప్రింట్ యొక్క మొత్తం సేవలను అందజేస్తోంది.